This chapter is on the blood vessels. What are the blood vessels? They comprise the delivery system of dynamic structures that begins and ends at the heart. Arteries carry blood away from the heart. Generally, the blood is oxygenated, except for the pulmonary circulation and the umbilical vessels of a fetus. Veins carry blood towards the heart. Here we see the heart represented by the block with the arteries carrying blood away, and generally it is oxygenated unless it's going to the pulmonary circuit or as it mentioned in a fetus. And then veins carry blood towards the heart, and generally it will be deoxygenated except for when it's coming from the pulmonary system. There are several types of arteries. Elastic arteries are large, thick-walled arteries with elastin in all three layers. It includes the aorta and its major branches. The large lumen will offer low resistance. These arteries act as pressure reservoirs. They can expand and recoil as blood is ejected from the heart. Muscular arteries are distal to the elastic arteries, and they deliver blood to the body organs. They have smooth muscle in their artery wall, and they are very active in vasoconstriction, which maintains blood pressure. The smallest arteries are called arterioles, and they lead to capillary beds. They control the flow of blood into the capillary beds via vasodilation and vasoconstriction. Vasodilation expands the blood vessels. Vasoconstriction contracts the blood vessels and narrows them. This illustration shows the elastic arteries, muscular arteries, and arterioles. The makeup of the tissue includes the fibrous tissues, the smooth muscle tissues, the elastic tissues, and then the endothelium. On the interior of the blood vessel wall will be the endothelium, and then the elastic tissues and the smooth muscle tissues will make up the walls, and then the collagenous tissues will surround the outer wall of the arteries. Capillaries are microscopic blood vessels located in all tissues except for cartilage, epithelia, the cornea, and the lens of the eye. The functions of capillaries are for the exchanges of gases, nutrients, wastes, and hormones. Capillary walls are 1 cell thick, and they consist of simple squamous epithelial tissue known as the endothelium. Remember, the endothelium lines the blood vessels, such as these larger arteries. So capillaries are just one lining thick. Therefore, parasites will help stabilize their walls and control permeability. And these are not parasites like worms or harmful bacteria. They're peri for surrounding, and then CYT, site, for cell. So these are going to be cells that surround the capillaries. The small capillary size allows only a single red blood cell to pass through at a given time. If you recall, that's one reason why the red blood cells have that biconcave shape and are so flexible. Venules are formed when capillary beds unite. Venules are very porous, allowing for fluids and white blood cells to enter into the tissues. Postcapillary venules consist of endothelium and a few pericytes. Larger venules have 1 or 2 layers of smooth muscle cells. This illustration shows capillaries and venules in the capillary bed. In the figure A of this picture, the sphincters are open and blood will flow through true capillaries and bring nutrients into the entire capillary bed. However, in figure B, the sphincters are closed and blood flows through a meta-arterial thoroughfare channel, bypassing the true capillaries. This is called shunting. Veins are formed when the venules converge. Veins have thinner walls, yet larger lumens compared with corresponding arteries. Veins are called capacitance vessels or blood reservoirs, and they contain up to 65% of the blood supply in the body. This illustration shows an artery next to a vein. You can see that the artery has a thicker wall and the vein has a larger lumen. The lumen is the center of the vessel. This pie graph chart shows the percentage of blood in the different vessels, and you can see that the systemic veins and venules account for 60% of that. The systemic arteries and arterials consist of 15% of the blood. Pulmonary blood vessels contain 12%. The heart contains 8%. And capillaries contain 5% of the blood. This illustration shows the anatomy of the capillaries, venules, and veins. Again, the capillaries are going to be one layer thick of just that endothelium tissue, and the pericytes will be around them. You can see a few of those pictured around the venule, or actually some smooth muscle wall cells. And then in the vein, it has all the same tissue types like the artery, except it has a larger lumen than the artery. This table shows the difference between arteries and veins. There's 4 things that are looked at here: delivery, location, pathways, and supply/drainage. For delivery, the arteries pump blood into a single systemic artery, the aorta, and in veins, the blood returns to the heart via the superior and inferior vena cava and the coronary sinus. The location of arteries are deep. They're protected by tissues. Veins are both deep and superficial. For the pathways, the arteries have a fairly distinct pathway, and veins have numerous interconnections called anastomoses. For the arterial supply and drainage, it's a predictable supply. With veins, it's usually similar to arteries, except dural sinuses and the hepatic portal circulation. Let's look at the blood flow through the body tissues. Blood flow is called tissue perfusion, and it is involved in the delivery of oxygen and nutrients to and the removal of wastes from tissue cells. It's involved in gas exchange within the lungs, the absorption of nutrients within the digestive tract, urine formation within the kidneys. The rate of blood flow is precisely the right amount to provide for proper function. Blood flows from a higher pressure to a lower pressure. The walls of the blood vessels provide resistance to blood flow. This is called peripheral resistance. The more resistance, the higher the blood pressure. A blood pressure gradient is the change in pressure from one end of the vessel to the other. This is what propels blood through the vessels, and the pressure is highest in the arteries and lowest in the veins. This shows the blood pressure changes throughout the systemic circuit. You can see that it's the highest in the aorta, and as it moves through the large arteries, small arteries, arterioles, capillaries, it's decreased. Finally, by the time it gets to the capillary beds, the blood pressure and the blood flow is very slow. And then to enter the veins and then go up the small veins, large veins, and vena cava, that's called venous return. And there are several factors that will affect this. Let's look at the arterial pressure before we go to venous return. The mean arterial pressure, or MAP, is the average arterial blood pressure across the entire cardiac cycle, so one heartbeat. Since diastole lasts longer than systole, the mean is weighted to be closer to the diastolic pressure. Remember that diastole is when the chambers are at rest. So MAP equals the diastolic pressure plus 1/3 the pulse pressure. So example, if blood pressure is 120/80, the MAP would be 80 plus 40 divided by 3 equals 93. This provides an index of perfusion, which is the blood flow. And so an MAP less than 60 may indicate insufficient blood flow. Pulse pressure is the pressure in the arteries added by the heart contraction. It equals the difference between the systolic and diastolic blood pressure. For example, pulse pressure equals 40 millimeters of mercury if the blood pressure is 120/80. It reflects the elasticity and the recoil of the arteries. These tend to decline with age and disease. Pulse pressure allows for palpation of a throbbing pulse in the elastic and muscular arteries. A higher pulse may indicate a higher blood pressure. The faster the heart rate, the greater the cardiac output. As the cardiac output increases, blood pressure also increases. The larger the stroke volume, the greater the blood pressure. Stroke volume and heart rate increase blood pressure only if the venous return is adequate. Measuring systemic arterial blood pressure. Systemic arterial blood pressure is measured indirectly by the oscillatory method using a sphygmomanometer. Pressure is increased in the cuff until it exceeds systolic pressure in the brachial artery. And remember, oscillatory means to listen. And I'm not going to try to say sphygmomanometer again. The pressure will be released slowly, and the examiner listens for the sounds of Korotkoff with the stethoscope. Sounds first occur as blood starts to spurt through the artery. The systolic pressure is normally 110 to 140 millimeters of mercury. Sounds disappear when the artery is no longer constricted and blood is flowing freely. The diastolic pressure is normally 70 to 80 millimeters of mercury. Vital signs: pulse and blood pressure along with respiratory rate and body temperature. Pulse, pressure wave caused by the expansion and recoil of arteries. Radial pulse, taken at the wrist, is routinely used, and these all help to monitor circulatory efficiency. Here we see pulse points at different locations, such as the superficial temporal artery, facial artery, common carotid artery, brachial artery, radial artery, femoral artery, popliteal artery, posterior tibial artery, and the dorsalis pedis artery. Variations in blood pressure cycles over a 24-hour period. Blood pressure peaks in the morning due to levels of hormones. Age, sex, weight, race, mood, and posture may all affect blood pressure. Hypovolemia is a loss of blood pressure. Causes include the kidneys fail to reabsorb enough water and salts, excessive fluid loss from vomiting or diarrhea, excessive fluid loss from third-degree burns, hyperventilation, a buildup of fluid in empty spaces, or an extreme loss of blood. And this can lead to hypovolemic shock. Hypotension is low blood pressure. Systolic pressure is below 100 millimeters of mercury. It is often associated with a long life and a lack of cardiovascular illness. However, sometimes hypotension can be problematic. Orthostatic hypotension is a temporary low blood pressure and dizziness when suddenly rising from a sitting or reclining position. Chronic hypotension is a hint of poor nutrition and a warning sign for Addison's disease or hypothyroidism. Acute hypotension is an important sign of circulatory shock. Hypervolemia occurs when there is too much water in the body. So it's too much blood volume. Hyper is too much. Causes include heart failure, kidney failure, cirrhosis, and pregnancy. It can lead to edema or swelling, high blood pressure, and heart issues. Hypertension is high blood pressure. It is a sustained elevated arterial pressure of 140 over 90 millimeters of mercury or higher. It may be transient adaptations during fever, physical exertion, and emotional upset. However, it is often persistent in obese people. Prolonged hypertension is a major cause of heart failure, vascular disease, renal failure, and stroke. There are two major types of hypertension: primary or essential hypertension and secondary hypertension. Primary or essential hypertension makes up 90% of the hypertensive conditions. It is due to several risk factors, including heredity, diet, obesity, age, stress, diabetes mellitus, and smoking. Secondary hypertension is less common. It is due to identifiable disorders, including kidney disease, arteriosclerosis, and endocrine disorders such as hyperthyroidism and Cushing's syndrome. Blood viscosity is the thickness of the blood. An increased hematocrit level, which is the level of red blood cells, can lead to an increased blood viscosity. Impeded blood flow occurs and can lead to high blood pressure and thrombosis, which would be a blood clot. Blood vessel length affects blood flow. The longer blood vessels create more resistance. Friction occurs along the length of the vessel. Weight gain or loss changes the vessel length. Weight gain associated with angiogenesis or an increased resistance, and weight loss is associated with vessel regression or decreased resistance. Now let's talk about venous return. Venous return depends on a blood pressure difference. The blood pressure must be higher in the systemic veins than in the right atrium. It also depends on the skeletal muscle pump and the respiratory pump. The contraction of skeletal muscles compresses the walls of the veins, causing blood to move through one-way valves. During inhalation, thoracic pressure falls and abdominal pressure rises. Blood flows from an area of higher pressure to an area of lower pressure. This is one of the reasons why exercise is so important to circulate your blood. This example shows the skeletal muscle pump. The contracted skeletal muscle pushes blood past the open valve. A closed valve will prevent the backward flow of blood. Vascular anastomoses are interconnections of blood vessels. Arterial anastomoses provide alternate pathways or collateral channels to a given body region. They are common at joints, in abdominal organs, the brain, and the heart. Vascular shunts of capillaries are examples of arteriovenous anastomosis. Venous anastomosis are common. Now let's look at bulk flow. Bulk flow occurs when fluids move down a pressure gradient. The movement direction depends on the net pressure of opposing forces. These forces are hydrostatic pressure versus osmotic pressure. During filtration, the fluid will move out of the blood. The fluid and small solutes flow easily through a capillary's openings, and infiltration occurs on the arterial end of the capillary. Reabsorption occurs when fluid moves back into the blood, and it occurs on the venous end. Hydrostatic pressure, or HP, is a force exerted by a fluid. The blood hydrostatic pressure is the force exerted per unit area by blood on a vessel wall. It promotes filtration from the capillaries. Interstitial fluid hydrostatic pressure is the force of interstitial fluid on the outside of the blood vessel. It is close to zero in most tissues. The osmotic pressure is the pull on water due to the presence of proteins. Proteins in the blood pull fluid from the interstitial fluid into the capillaries. And remember that interstitial fluid is the tissue fluid. The net filtration pressure, or NFP, is the difference between the net hydrostatic pressure and the net osmotic pressure. NFP changes along the length of the capillary. It is higher at the arterial end than it is at the venous end. At the arterial end, the net filtration pressure favors filtration. At the venous end, the net filtration pressure favors reabsorption. This illustration shows the arterial end of the capillary and the venous end. In the arterial end, filtration is favored, as blood hydrostatic pressure is greater than net osmotic pressure. In the venous end, reabsorption is favored, as the net osmotic pressure is greater than the blood hydrostatic pressure. We can see that at the arterial end, the fluid will be forced out of the blood vessel, and on the venous end, the fluid will be drawn into the blood vessel. Blood pressure homeostasis. Blood pressure must be kept in proper range, must be high enough to maintain tissue perfusion, but not so high as to damage vessels. Blood pressure depends on cardiac output, resistance, and blood volume. These variables are regulated by the nervous and endocrine systems. For the neural regulation of blood pressure, the vasomotor center in the medulla oblongata regulates vasoconstriction. It is under the control of the cardioregulatory center. Baroreceptors in the blood vessels near the heart detect changes in blood pressure. Hormonal regulation of peripheral resistance comes from several sources. First, epinephrine and norepinephrine increase heart rate and constrict arterioles in the skin, abdominal viscera, and kidneys. Antidiuretic hormone causes the reabsorption of water and vasoconstriction. The renin-angiotensin-aldosterone system features the angiotensin II, which constricts the arterioles, and aldosterone causes the reabsorption of sodium and water in the kidneys. Now let's take a look at some systemic arteries and then some systemic veins. For the systemic arteries, they branch off of the aorta. Oxygenated blood is pumped from the left ventricle to the ascending aorta. The left and right coronary arteries arise from the ascending aorta to supply the heart wall. The ascending aorta curves left and becomes the aortic arch. Three main arterial branches branch from the aortic arch: the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk bifurcates or splits into the right common carotid and the right subclavian arteries. The right common carotid supplies the right side of the head and neck. The right subclavian supplies the right upper limb and subthoracic structures. The left common carotid artery supplies the left side of the head and the neck. The left subclavian artery supplies the left upper limb and some thoracic structures. The aortic arch curves inferiorly to become the descending thoracic aorta. it has several branches supplying the thoracic wall and viscera. As it passes through the diaphragm, it becomes the descending abdominal aorta, which supplies the abdominal wall and organs. At the level of the fourth lumbar vertebra, the abdominal aorta splits into the left and right common iliac arteries. Each of these splits into an internal iliac artery for pelvic structures and an external iliac artery for the lower limb. This illustration shows the aortic arch and the branches, as well as the descending aorta. So here's the aortic arch, and we see the left subclavian artery, the left common carotid artery, and the brachiocephalic trunk. And then the aorta descends and splits into the common iliac artery. Now let's look at some GI tract arteries. Arterial supply comes from the abdominal aorta. There are 3 unpaired arteries that serve the GI tract: the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. This illustration shows the celiac trunk and the branches. The left gastric artery, the splenic artery, and the common hepatic artery. The left gastric artery supplies part of the stomach and the esophagus. The splenic artery supplies the spleen, part of the stomach, and the pancreas. The common hepatic artery supplies the left hepatic artery, left half of the liver, the right hepatic artery, which is the right half of the liver and the gallbladder, and then the right gastric artery, which is part of the stomach. There's also the gastroduodenal artery as part of the common hepatic artery, and this supplies part of the stomach, the duodenum, and the pancreas. In the mesenteric arteries, the superior mesenteric artery and branches include the middle colic artery, which supplies most of the transverse colon, the intestinal arteries, which supply the jejunum and ileum, the right colic artery, which supplies the ascending colon, and then the ileocolic artery, which supplies the ileum, cecum, and appendix. Then the inferior mesenteric artery and branches include the left colic artery, which supplies the distal part of the transverse colon and most of the descending colon, the sigmoid arteries, which are part of the descending colon and the sigmoid colon, and the superior rectal artery, which supplies the rectum. There are arteries that supply the posterior abdomen, and the organs that are supplied here are supplied by the middle suprarenal artery, renal artery, and the gonadal artery. So the middle suprarenal artery supplies each adrenal gland. The renal artery supplies each kidney. The gonadal artery supplies each gonad. All 3 of the above arteries branch off the descending aorta and are drained by veins with the same names as the arteries mentioned here. Now let's take a look at some systemic veins. Blood returns to the right atrium by 3 vessels: the superior vena cava, inferior vena cava, and the coronary sinus. The superior vena cava is formed by the merger of the left and right brachiocephalic veins. They drain the head, neck, upper limbs, thoracic, and abdominal walls. The inferior vena cava is formed from the veins below the diaphragm. They carry blood from the lower limbs, the pelvis, perineum, and abdominal structures, and they lie to the right of the descending abdominal aorta. The coronary sinus drains into the right atrium, and it carries deoxygenated blood from the heart myocardium. This illustration shows the different veins. You can see the superior vena cava and the inferior vena cava. And now we'll talk about the hepatic portal system. The venous return in the hepatic portal system takes blood from the digestive organs to the liver. The digestive system blood comes from three main veins that drain into the hepatic portal vein. The splenic vein, which is horizontally positioned, the inferior mesenteric vein, which is vertically positioned, and the superior mesenteric vein, which is vertically positioned on the right side of the body. The hepatic portal vein flows into liver sinusoids, and blood leaves the liver by hepatic veins that drain into the inferior vena cava. This illustration shows the hepatic portal system. This is a very large vein and is easily seen in like the fetal pig dissections. This illustration shows healthy food to help you maintain a healthy blood vessel system. And notice that in each of these categories, it's going to be fruits and vegetables. So white fruits and vegetables support the immune system, the protection of the stomach, lower cholesterol, support a healthy heart and a healthy gut. Yellow fruits and vegetables support low cholesterol, a healthy heart, healthy joints, eye protection from vitamin A, and they prevent cancer. The red fruits and vegetables support a healthy heart, healthy blood vessels, skin protection, cellular rejuvenation, and also prevent cancer. Purple fruits and veggies support a healthy heart, healthy blood vessels, improve your memory, cellular rejuvenation, and protecting the urogenital system. Green fruits and veggies protect the stomach, make healthy bones, give you eye protection, support the immune system, and prevent cancer. So happy eating. Thanks for listening.